JW is a 30-year-old man presenting to the emergency room with blindness and leg weakness. He tells the admitting physician that he couldn't see any light out of his left eye, and this started recently. Several years ago, JW ate a suspicious meal. He was chewing on a carrot when he thought something was kind of weird. It smelled funny. Didn't matter that there was a little bit of dirt on it. His fiancée thought, oh no, something's going to be wrong. And she was right. A few days later, JW started feeling crampy abdominal pain that was associated with bowel movements out of both ends. Sometimes he'd cough, and when the loogie came up and he hacked it back down, he could have sworn that more than just phlegm was going back into his body. He didn't know if it was the meal that caused this though, because he had had this problem almost his entire life. He'd go to the doctor's office and they just couldn't figure out what was going on. His abdominal pain would just magically happen to go away at the time that he was in front of the doctor, and when he'd get home, it was like his soul was exiting his body from his rear. 3 months ago, JW looked back into the toilet after a bowel movement, and he thought he saw something moving inside. When he went to the doctor to ask, they took a sample of his stool to look at, and they found the problem. Multiple worms, 3 to 12 inches in length, were found, and under a microscope, they found multiple eggs that were consistent with at least one parasite species known as Ascaris lumbricoides. They were living and reproducing in his gut. This kind of makes sense based on what he ate and where he lived. Sometimes soil gets contaminated with parasite eggs, and sometimes foods will have soil on them, and someone might eat them, not thoroughly washed. Well, those parasite eggs are now inside that person's gut. For Ascaris lumbricoides, once the worms hatch inside humans, they absorb into the bloodstream and then migrate into the lungs. So JW was right. He was coughing up more than just phlegm. Those were worms coming up that he was swallowing back down, back into his gut, where they would mature into adults, mate, and release eggs into his bowel movements. This would contaminate soil again, repeating the cycle all over again in a place where this can be a problem, just like where he was. But this is easy to treat. A small dose twice daily for 3 days of a parasite medicine should cure him of the worms. It can't prevent him from getting reinfected, but it'll eliminate the worms, no problem, and JW was sent on his way. He took the medicine at home, and everything was great, but very quickly, something was wrong. One morning, JW couldn't stop scratching on his left side. He found a rash, and when he looked at it, it was almost like his skin was sloughing off. Immediately, he stopped the medicine, and when he started searching online for tips on what might have happened, it told him that this was a life-threatening allergic reaction caused by the medicine. So, not only did it take doctors almost 30 years to figure out that he had worms, but it looked like they were trying to end his life now, he thought. Angry, he stopped taking the medicine. His stomach still hurt, worms were still in his stool, and his skin was ripping off of his body. Back at the hospital, JW argued with the doctor. It took them so many years to figure out what was wrong with him, and their fix almost ended his life. Fed up, he walked out, and he was going to find his own answers. At home, JW started looking online. He found posts about how humans are animals, and farm animals get parasites, the same ones that humans can get. So, medicines that treat their worms treat our worms too. This isn't wrong, it's not irrational, but humans aren't farm animals. There's medicines that we can take that they can't, and there's medicines that they can take that we can't. But JW was so fed up and so upset that it was time to take matters into his own hands. At a shop online, JW purchased goat Dewormer. His fiancée thought something was up. She took a look. She knew about his worms. She knew about his decades-long struggle with them, but she saw farm animals on the bottle and she just asked if he was one of them, and all he replied was yes. The bottle said 1 tablet per 22 pounds of body weight, and given that he weighed 222 pounds, he was going to take 10 tablets every day until this bottle was done, and his worms would be gone. Immediately after taking the goat Dewormer, JW felt good. The tablets were chalky, but he noticed that he didn't get a rash. Anytime that he used the bathroom, he could swear he felt it was working. As the days passed, JW noticed that it was getting harder to see. He wasn't sure if maybe his eyes were just watering, and every time he scratched them, it would just get a little bit blurrier and never recover. And he could feel that it was kind of hard to walk, and he could see that parts of his hand were starting to twitch for no reason. One morning, he opened up his eyes and everything was dark. He had trouble standing. Everything hurt. He started emptying his stomach out of both ends again. But finally, he couldn't do it anymore as he collapses to the ground. An ambulance is called, and he's brought to the emergency room, where we are now. At examination, the medical team looked at JW's eyes. He complained that he couldn't see and that this had been happening for several days. When they took a closer look, They noticed that something was wrong where the optic nerve connects to the eyes. Some blood vessels were swollen, and other parts looked like they had atrophied and died. This explains why he can't see, but this wasn't his only problem. His legs were weak, and his stomach was having trouble moving things along. His fiancée showed doctors the bottle of goat medicine, and it gives them some clues as to what's happening. The goat dewormer that he took is a combination therapy of ivermectin and closantel. Ivermectin being the base chemical that became the more well-known ivermectin, an anti-parasite medicine, and closantel, something that comes from an interesting group of medicines that have a chemical structure similar to aspirin. But how do these work? Ivermectin floods the worm with negative ions. Because nerves and muscles use electricity to function, the difference between negative and positive charges helps move things along. But having so much negative charge that it's the predominant thing around means things don't move along, and so the worm becomes paralyzed. This could take care of all the worms by itself, but adding a second medicine ensures that you can get all of them. Taking too much ivermectin can be ruled out as the cause of some of his problems, but closantel is where his permanent, irreversible damage is coming from. Closantel starves the worm of energy. It destroys its metabolism. It's an extreme version of what overdosed aspirin does. And that makes sense because the chemical is based on aspirin. There's a highly not recommended chemical, sometimes used for weight loss, called dinitrophenol, that does the exact same thing. The problem is, if closantel destroys the worm's metabolism, it's very likely that it's also destroying the metabolism of the patient taking the medicine. But aspirin overdose doesn't cause permanent blindness, neither does dinitrophenol. So what's happening? The answer is, we don't know. But what we do know is that closantel is in a class of medicines that do a lot of different things. Something that we describe as having a wide spectrum of biologic effects. The first medicine of this kind was used to get rid of snails because they were hosts for flatworm parasites. And this was in the 1950s. And back then, they thought if this works for flatworms, does it work for other worms? And the answer was yes. But it goes further. These also have antifungal and antibiotic functions. They were used as antimicrobials in cosmetics, but people found out that doing that causes skin disorders, so they weren't allowed in that setting anymore. And more in-depth research shows that they can shut down other parts of human cells in multiple ways. Because he took so much of it for so long, it looks like all of these things are happening to his body. So we don't know exactly why closantel causes humans to go blind, but we know that it does. Luckily, we know how to treat some of the symptoms. The immune system gets involved when the nerve gets damaged. If steroids are there in time to limit the immune system, then that can prevent some damage for JW as the medical team gives this to him over the next few days. People taking animal medicines isn't new, and it is true, there are similarities in veterinary medicine and human medicine. I'll give you an example. Certain antibiotics used in humans can be used in cats and dogs, like amoxicillin clavulanic acid that we take for dental infections, but can be used at a different dose for cats and dogs because they have teeth too. Fundamentally, the reason is straightforward. Regardless, human, feline, canine, it's the same bacteria doing the infecting, and the antibiotic is targeting that bacteria. And felines and canines happen to have livers and kidneys that can process and break down these antibiotics in similar ways to our liver and kidneys, so they can be eliminated in waste. You probably wouldn't want to take your cat's antibiotic, and you may not want to give your cat your antibiotic because the dose is different, because a cat body isn't a human body. If you think people don't take veterinary antibiotics, a voluntary survey of 400 people said almost 5% do it. The real number may be lower or higher, but someone's doing it. So that's when the animal is smaller than a human. What happens when the animal is larger than a human? A relatively recent phenomenon out of the Northeast United States is horse tranquilizer showing up in the streets. You may have seen those videos coming out of Philadelphia. In horses, this is a nervous system depressant and a muscle relaxant. It does that in humans too, except it also causes horrible skin ulcers, and these don't easily heal, and they eventually get infected. But none of this happens in horses because this medicine isn't supposed to be taken by humans. Just like how you shouldn't give cats Tylenol, some medicines are for specific species, and if the package says that it's not for humans, you shouldn't take it, and instead take the version made for humans. Speaking of dose, the interesting thing about closantel is that in goats, it's also known to cause blindness if too much is given. So the toxic effect here is conserved between patient species. But there's millions of nerves in human and goat bodies. Why does this one particularly damage the eyes? Again, We don't know. But do you remember how closantal destroys metabolism? That's probably still happening to JW because parts of his liver had sloughed off and they were detected floating around in his blood. His muscles were wasting away and the parts that had broken off were starting to collect in his kidneys, shutting them down. All of these are metabolically active organs that can't function properly now because closantal has broken energy production, and his condition wasn't improving over several days. Not too many humans have been documented to have taken closantal, and it's not studied a lot compared to other medicines, but a report did show that a dose just 30% of what JW took has caused blindness. Ivermectin in very large doses is known to cause neurotoxicity because that's how it works in normal doses in the worms. It's likely ivermectin also contributed to his liver and his kidneys shutting down. The doctor monitored him over a few days to see if the steroids were working, but JW had been taking this medicine for 10 days. He took continuous doses meant for a livestock animal and ended up swallowing the whole bottle. There wasn't enough time for the medical team to give him the appropriate therapy when he presented to the emergency room. The one thing that can be done is to exchange the plasma in his body to remove the closantal floating around in his body. But because he didn't trust doctors, he refused this. 4 days after he arrived to the hospital, JW's kidneys had completely shut down. His urine was colored like sesame oil, and it was filled with sugar and metabolic waste. Blood tests indicated that his liver had completely shut down, and then he developed an abnormal heart rhythm. Suddenly, his heart was shaking in place, not actually moving any blood out anywhere in his body, and doctors weren't able to resuscitate him. This didn't have to happen. He was right to stop the first medicine, which was mebendazole, when it gave him the rash. That was something that could have become life-threatening very quickly. But ironically, the next medicine for his worms was avermectin, or ivermectin, alone, no closantal, because this is what ivermectin is for. And he would take the human version, not the livestock one. Animal medicines are for animals. Human medicines are for humans. Thanks so much for watching. Take care of yourself and be well.